So here we go. They'll be able to see.
Good morning from New York, and welcome to today's event, which is being hosted by the United Nations Department of Economic and Social Affairs. My name is Marin Jimenez. I work in the department's Division for Inclusive Social Development, and I'll moderate today's event. Over the past year, our division has organized a series of webinars to spotlight issues of insecurity, inequality, and poverty. These are longstanding work streams within our division we see increasingly compounded by new systemic threats, including the current COVID-19 pandemic. Today, we're really pleased to have with us Deborah Carr, Professor and Chair of the Sociology Department at Boston University. Professor Carr is an eminent expert in the intersection of two of the priority areas for our division, that of aging and inequality. To kick off today's discussion, we have a short welcome message to play from the Director of the Division for Inclusive Social Development, Ms. Daniela Bass, who unfortunately could not be with us today. It seems like, unfortunately, we're having technical difficulties. It doesn't appear that the audio is working right now. Apologies for that. In the interest of time, I believe that we'll skip the video for now, but Ms. Bass sends her warmest welcome and wishes for a successful discussion this afternoon, or this morning, excuse me. Before I turn the floor over to Professor Carr, some housekeeping notes. Professor Carr will speak for about 30 minutes, 25-30 minutes. During the course of her presentation, should you have any questions or comments, please enter them in the chat box, and I will read them out during the discussion session that will immediately follow. Professor Carr, thank you so much for being here with us today, and without further ado, the floor is yours.
Well, thank you so much for your warm invitation, and I'm looking forward to speaking with you today and hearing your questions and your own comments and insights into aging and the intersection of aging and poverty worldwide. So I am going to put up my slides right now, and if anybody has a problem, please raise your hand. We will make sure that everybody can see properly. Great, are we all good? Great. And I apologize that there is a dog scratching at my door very loudly right now, but I'm going to stay as focused as possible on this topic of tremendous importance, of tremendous global importance. And I think inequalities in aging is something those of us who work in the field have been aware of for a very long time. But the COVID pandemic has really cast a global spotlight on the fact that older adults are vulnerable to a range of health concerns and economic concerns. And those challenges are most acute for those who already have been suffering from economic adversity, not just since their 65th birthday, but going back to really early life influences. So when I talk about later life, which at least in the US tends to be those who are age 65 and older, in other nations, there might be a different cut point for what constitutes old age. These disparities in health, longevity, mental health, again, don't appear magically on one's 65th birthday, but really are the end product of the accumulation of inequalities going back to birth, if not in utero. And as I argue in this book, which you see here and other writings, even making it to age 65 is a gift. And those communities that are the most under-resourced are not even likely to make it to age 65, and in fact suffer some of the physical symptoms of aging at much younger ages because of the physical and economic adversities that they have experienced going back to their much younger years. So page down. Great, so the question today is, are later years really golden? And for those of you who could only stay for 5 minutes, the answer, not surprisingly, is no. There are many people, and in fact, in the United States, it's the statistical majority of older adults who actually do have economic well-being, good health, safe housing, supportive family relationships, children to take care of them. But there are large numbers in the US and in every other nation who do not. So for every lovely person who has a yacht, as you can see over here, there's a fraction who are homeless, again, at age 97. And it's very likely that this person that you see in this photo here had challenges earlier in life. But in other parts of the world as well, you can see there are those who are married, who have access to the latest assistive devices, who have lovely housing, whereas others are toiling under really difficult circumstances and have no public support or sometimes even family support, forcing those who already have the frailest bodies and the poorest nutrition to work into their latest years. So an overview of the talk today, and if I don't get through everything, we can just toss it over in the Q&A. But first, I'll talk a bit about why there is such a vast divide between essentially the haves and have-nots in old age. And these disparities transcend just income, just physical health. There are things like energy, cognitive engagement, hobbies, purpose, loneliness versus social integration. Well-being in old age really is a very large bucket that encompasses both economic, physical, cognitive, and psychological well-being. So another theme that I'll talk about a lot today, that's something I argue in my book and in a lot of my work, harkens back to a point that you heard earlier in the introduction. We often think, those of us who are population researchers or healthcare professionals or development workers, we think about poverty, right? We also think about old age, but we often don't put them together. And one theme that I'll be talking about considerably today is that old age, the biological processes of old age, can actually intensify the harmful consequences of poverty. We know that poverty has difficult consequences for people of all ages, but the impacts can be felt most severely for those who already have frail and failing bodies. And likewise, the normal processes of aging, it's going to happen to all of us. We will have wrinkles and gray hair and reduced lower body strength and upper body strength. And all of those normal processes of aging that are going to happen to most people happen earlier, the declines are quicker, and they come on with greater intensity for those who have lower levels of education, lower levels of income, no savings, no access to healthcare, or limited access to high quality care. So I'll be touching on that. Another topic is that when you study aging, we think about those people who are old today, right? Those who withstood the depression in the Western world, for instance, those who had access to things like the GI Bill. But we're all going to get old someday. And what will old age look like for Gen X and for millennials? And as much as I am an optimist by nature, when I think about the aging processes of kind of my cohort, Gen X forward, it does not look good for some reasons I'll talk about. There's going to be some for whom the later years are golden, if not platinum, but given trends like widening levels of income inequality, intensified disparities in longevity on the basis of social class, race, and ethnicity, I suspect for large and growing proportions of midlife and young adult cohorts, old age is going to look really quite bleak. And so unless there's some major policy change, not only in old age policies, but early life policies, which is going to be another theme we'll get through, to that educational interventions early in life really can pack a wallop, even for risk of ADRD, Alzheimer's disease, decades later. So I'll talk a bit about that. Then I'm hoping as a group that we can discuss recommendations for policy and practice to help reduce vast disparities in the quality of life that older adults lead. So Most people here today know that we are having a graying of the world population. Every nation in the world is growing older, whether we use the average age of the population or the proportion who are over age 65, whatever metric we use to capture an older population. It's happening pretty much everywhere. So this chart's pretty self-explanatory. It's a map of the world, and the blue bubble here tells you in 2015 what proportion of the overall population was age 65 or older. The dark blue bubble next to it is a projection by the year 2050, what proportion of the overall population will be over age 65. And it's really remarkable that, especially in North America and the United States, it'll be 1 in 5 people will be a senior citizen by the year 2050. And as you can imagine, that will affect every profession, every policy, people from all walks of life. One of the biggest issues is a shortage of not only family caregivers, because people are having fewer children, but also a shortage of paid caregivers. And I'll talk more about that later, but our paid caregivers work under distressing conditions, as the COVID pandemic showed us, but also with really quite pitiful wages. So trying to develop a new cohort of care workers is going to be a major challenge for the United States, and I suspect many other parts of the world. And even very young populations like Africa, which is very young because of high birth rates and higher levels of mortality, we see an almost doubling, right, in the proportion of those who will be older adults. So this is just by way of saying every nation in every corner of the world will need to prepare for the rising proportion of their population that is over age 65. So now I'll focus a bit on the US. I specialize in the US, but wherever possible, I'll try to give hints about what might be happening in other countries. And one issue that many of us care about is late life poverty. And in the United States, and in fact, other wealthier developed nations, there's kind of a rhetoric today that older adults are doing just fine. And there are debates about should we continue to support Social Security to the same level and perhaps should move funding down to early life programs. And there's a generational battle in the United States, which is something I'll follow up on in a moment. But in the aggregate, yeah, it does look like things are improving in the United States. Way back here, if we follow that dotted orange line, back in the early 60s, late 50s, more than 1 in 3 older adults lived in poverty. And you hear this tale, I'm not sure if it's true or a wives' tale, that there were stories on the evening news about old people eating cat and dog food because they couldn't afford anything else. Really, old people were viewed to be impoverished. And then, as you can see, this proportion just plummeted with the onset of Social Security and the expansion of Social Security. So recently in the United States, it looks like older adults are doing pretty well. About 10% live beneath the federal poverty line, which is much lower than the proportion of children, right? 18 versus 9. So that does lead some people to say, hey, this is not a population that's in need of public support. And these are just a couple of headlines some of you might have seen. They've gotten worse in the pandemic with calling COVID the boomer remover. Ageism has really intensified. But there's a lot of public rhetoric about how older adults are doing just fine. The baby boomers are trying to rob the rest of us. The geezers are greedy. They're taking things away from the millennials. And so there's this kind of generational debate that's happening. And the argument up here in the Washington Post that we don't need to expand Social Security because our elderly are doing mostly fine. Well, maybe that's true if you look at that aggregate statistic of 10%. But what happens when you start breaking things down by population subgroup? Well, we see here on this chart that that aggregate statistic conceals these vast subgroup differences for women of color in particular. Women of color who live alone, poverty rates are as high as 30 or 40% in the United States, again, which is really jarring. These are exactly the same communities who were hardest hit by COVID, who also have other challenges like being custodial grandparents for their grandchildren when their children face stressors like COVID or addiction, for instance, due to systemic racism. So the notion that older adults are doing fine based on a statistical snapshot is really misleading. And the same may be true in other nations, right? That snapshot really is going to be an underestimate of those who in some communities really are facing tremendous need. There's one other point that I'll go through very quickly here because it's a very technical point, but this is true for the US. It may also be true in some of the other nations that are represented by the researchers and the development officers here today. That poverty measure that looks kind of so good for older adults, 10%, is the federal poverty line. And there's been a movement in the United States to use a different poverty measure when studying older adults. So the main reason is that the federal poverty line here, you can see the official poverty measure here on the left, it undercounts. It doesn't really capture older adults outsized medical expenditures. And so we use this new measure here on the right called the supplemental poverty measure that really is a more accurate snapshot of medical expenditures. It looks like the 9.3%, see that blue, that 9.3% of older adults living in poverty, that jumps up to 15%. And so I'm not going to say too much about this now, other than to say, as researchers, we really need to think about whether the poverty metric we're using for older adults is appropriate. Does it really capture their daily lives, which include much higher expenditures on prescription medications and medical care than for most younger populations? Likewise, if we look at an aggregate statistical snapshot of old age poverty in the worldwide, yeah, it might look like it's pretty good relative to prior years, about 13.5% of older adults worldwide. This middle bar here with a little cartoon here live beneath the national median household income. But again, we see tremendous disparity here. I mean, Korea is a very wealthy nation, relatively speaking. And again, 45% of older adults are living kind of beneath that median household income. Whereas in other countries that always do really well because of their social safety net in Scandinavia and elsewhere are doing really quite well. So even those of us who are data people need to move away from just looking at Europe, Asia, really breaking our data down by country to get at these fine-grained differences. So that's the income side. I'll just talk real briefly about one other outcome that's often considered like the key marker of the well-being of a society, and that is life expectancy. So again, up until relatively recently, the story of life expectancy in most parts of the world, taking away those places that have been really hard hit by HIV/AIDS, in past years, we've seen life expectancy increasing just steadily over time, right? Back in the 20s, the average baby would live to be about 56. Today, the average baby lives to be about 75, although this varies really dramatically by social class and race. But one thing we've seen in the United States, even prior to COVID, was going back to about 2015. We've had the first time in about 100 years that life expectancy has started to creep downward, not dramatically, but a little bit, but it's been 5 years in a row. And it hasn't been all communities that have seen a pushback, right, in their life expectancy. It's been overwhelmingly low-income communities. It's due to things like the opioid epidemic, which continues today, which kills people at younger ages, the impacts of obesity, addiction, suicide, and these deaths of despair, as some economists at Princeton have called them, disproportionately strike underserved communities and are really driving declines in how long people are living in the United States. So underscoring this point again, that making it to age 65 is increasingly a gift for those communities that face economic concerns and social concerns. Here, just to kind of illustrate this point, there's a lot of data going on here, but the main thing for us to look at is overall, so this is expected age at death for those who are 40 years and older. So it basically shows if you make it to age 40, again, which in some communities is kind of an accomplishment, how long can you expect to live? What is your life expectancy change? There's all kinds of stuff going on here. One is for men, one is for women. But the main takeaway message is that each of these different bars of different colors represents different income quartiles. And over time, everybody's doing better, but the steepness of the slope is much sharper, meaning much more promising for those who are at the top income quartile. For those at the bottom of the income quartile, it's kind of flat. They're not experiencing these same gains over time that others have experienced. And these are exacerbated by COVID-19, which we know is killing frontline workers, bus drivers and food service workers and those who live in crowded housing, for instance. So there's the anticipation that these bars will grow even more bifurcated as we move past 2015. So again, everyone, for the most part, is doing better up until that 2015 turnaround, but far less so for under-resourced communities. So one discussion that you often hear in the United States and other parts of Europe is that, well, older adults are doing fine health-wise because we have Medicare, right? In the United States, when you reach a certain age, usually around 65, you have access to Medicare, which gives you access to healthcare that you might not have had earlier in life. But be that as it may, even if this does give people access to care, it is far from a panacea. It is not a cure-all for many reasons. One is that, again, those people who face the greatest adversities, the jobs that are the most difficult, they often do not survive until age 65, right? We know that stress and adversity hastens the pace of aging. Another is that those who are poor, who rely also on Medicaid, which supports access to care for low-income people, not all healthcare providers will take Medicaid. And many people might have stories about how they tried to find a provider who would take their Medicaid insurance and they wouldn't, or the wait would be long. The wait would be so long that their symptoms would just intensify, or the healthcare provider who took Medicaid was 3 towns away, which requires reliance on public transit. So again, there are these services which are wonderful. Medicare, Medicaid are tremendous social programs, but they don't help to cure that gap in mortality that we're seeing. Then also Medicare coverage is not comprehensive. I think a lot of folks don't actually know this, but Medicare, meaning the insurance we're all going to get when we hit our 60s, it doesn't have dental benefits. It doesn't cover all of our prescription medications or assistive devices and hearing aids and walkers and a whole range of things that we need, not only for our health, but for our social integration that's so important. Dental health impacts our capacity to eat and to speak and to feel respected by others based on how one looks. And of course, you can pick up other forms of Medicare that cover those. There's Medicare parts A, B, C, and D, but it costs something. And those older adults living check to check might not have the luxury of being able to afford these add-ons, if you will, to Medicare, which give them access to these other things that are so critical, not only to health, but to social engagement. So that's kind of a big picture. What I'll do now is just talk about some kind of theoretical / practical issues that certainly are evident in the United States, but also in every other corner of the world that you all work with. So one of the themes that I wrote about in the book Golden Years and in other papers is that the indignities of economic disadvantage or poverty are worse or intensified by these natural and inevitable aspects of old age that are going to happen to all of us. So if we think about low-income neighborhoods, right, they don't have very good sidewalks. They have cracked sidewalks, as you can see over here. They have traffic lights that are shorter, actually, than in more well-resourced neighborhoods. So you have to kind of hustle to get yourself across the street at the crosswalk. So those aspects of living in a poor neighborhood are kind of a nuisance for anybody. If you're 15, if you're 40, yeah, it's kind of a nuisance if you have cracked sidewalks in your poor and under supported neighborhood. But what happens when biological aging takes over? And you do have a little bit of dizziness due to some heart conditions, or you do have an unsteady gait just because of normal aging. What might happen with our lower body? You'll have balance problems. You might have arthritis. That cracked sidewalk that was a nuisance for someone who's 15 can actually be an indirect death sentence for someone who is 75 and wobbly, because we know that falls are the leading cause of ER visits for older adults, and also the secondary consequences of falls are really quite harmful. They can escalate into a range of other health conditions that are very difficult for older adults. So that's just one example. Another example, here, this is a picture from India, but the case could be anywhere. Think about in low-income neighborhoods not having a good air conditioner or having no air conditioner, or likewise in cold climates not having a good heating system, right? This is something that we see pretty much everywhere. Again, it's a nuisance if you're 40 and you have to put on some extra blankets or you're sweating a little bit, but think about what that means for older adults who, due to normal biological processes of aging, are already at an elevated risk of hypo or hyperthermia, meaning being too hot or too cold. Kind of your internal cooling system doesn't work quite as well. Then likewise, one third example that you can see over here, physically arduous labor. We know that people with lower levels of education have access, or no education for that matter, don't have access to cushy jobs like doctors, lawyers, and professors. And they're either working in construction, they're working as janitors, they're working in the fields, as you can see in that paper, in the photo here. Again, that kind of physical work is hard for all people, but for older adults who are forced to work due to economic need, who have the frail bodies and the lack of balance, for instance, and the sensitivity to hot climates or cold climates, this kind of work, again, can take a much more severe toll. So again, that intersection of age and income. The biology of aging, this happens to all of us, right? Every single one of us will experience some of these things, like declining immune function, as we saw with COVID. Unfortunately, our body fat percentage increases, aerobic capacity diminishes. Again, these are things that are just universal. But when we think about what they mean in practice, in daily life, those universal vulnerabilities of aging do have harsher consequences for those who have fewer economic resources, those who were forced to work. Again, these examples that I give here are probably more relevant for higher income rather than lower income nations, but you can all think about different applications in the sites that you represent. So one is assistive devices. Like, we could all use an assistive device like a walker or a cane at some point, but again, they're out of financial reach for lower income people for the reasons that I mentioned earlier, right? That you're covered by Medicare Part D, which you have to pay for. And maybe you can get like a cheap cane at the Salvation Army, but it might not be as supportive and strong as some of these higher quality ones. Another issue is thinking about compromised immune function. This happens to all of us with age. And that's part of the reason, again, why the pandemic was so much worse and the mortality rates from COVID were so much worse for those 85 plus versus those who were younger ages. But those compromised immune systems might be worse and might be triggered ways for lower income older adults who just have a range of stressors that compromise their immune system. So in the United States, something I mentioned earlier, we know it's lower income older adults and often women of color who are more likely to play this role of being the custodial grandparent, meaning their child faced some crisis that prevent them from parenting, whether it's murder, suicide, opioid addiction, incarceration. So the child, or basically the mom of the child in this photo, is taken out of the scenario. And so grandma comes in and lives with this child. And those of you with school-aged children know that when they come home from school with the sniffles, everybody in the house is affected, which is, again, a hassle at 35, but it again, can be really much more dire for a grandma who's in her 60s or 70s and is vulnerable to those type of infections. So just one of many examples. Then another is ageism. Ageism is something that affects mental health, meaning mistreatment on the basis of age, people speaking to you in a disparaging way or an infantilizing way. Things like, "How are you today, young lady?" when you're 80. So ageism is something that's universal, as we know. But how do we know that someone is old? What triggers us to say, "How are you today, young lady?" It's their physicality, right? It's what they look like. And we know that old age shows up earlier for people who face more adversities. If you are a professor who can afford a gym and can afford a colorist, you can look 50 when you're 70. If you're someone who can't afford to fix your teeth, you have wrinkles from stress, you have a hunched shoulder from working in a difficult job, all the physical signs of aging tend to occur earlier for those who face greater adversity, meaning those who need the job most might face the highest level of discrimination in the hiring process, as you can see here, because they're looking older at a younger age. And it sounds like kind of a shallow point, right? Kind of a cosmetic point, but we know for low-income women who have a divorce, who need to support themselves, re-entering the labor market can actually be quite difficult because ageism is real and it tends to be more acute for women and women who work in professions that are outward-facing, right? And it can even be a waitress, an office administrative assistant who's the outward-looking face of that company. So again, this is a whirlwind tour, but you can think of examples in the places that you study. So why is this? I'll go over the why quickly, then just a couple generational comments, and then we'll move things over to Q&A and conversations. So the big theme that I'm sure all of you know is, again, these late life inequalities don't come about all of a sudden magically as someone's 65th birthday. And sociologists and economists and development workers often use a theory called cumulative disadvantage. And it basically says early in life, there might be kind of small differences between two people, but over time, those differences on the basis of class just exacerbate. You can picture it like a rolling stone that keeps acquiring more moss or more dirt. So you might think of two classmates in elementary school. One is from a low income background, one's from a higher income background. The lower income child maybe drops out of high school to support their family, works in blue collar jobs, hurts their back on the job, has lower literacy skills, so is less able to kind of abide by the healthcare regimens that their doctor assigns them. Whereas a child from the higher income family goes on to a college education in a good job with benefits and a home in a neighborhood without pollution. And so whatever seems small early on just gets bigger and bigger over time. And so this exacerbation process happens. And again, just early disparities. It can be things like how many years of schooling you have, how many years of schooling mom or dad had, whether your parent is a blue collar worker like a laborer or a white collar worker like a lawyer. Those give rise to these life course trajectories of a whole range of things: the quality of your job, how old you are when you marry, whether your marriage stays intact or dissolves, one's capacity to raise children in a way that is relatively stress-free, and then ultimately economic well-being. And for this reason, there's a growing body of research demonstrating that early life factors have long-term implications 50, 60, even 70 years later. So again, if anybody has to leave the session at 10:30, one important takeaway is investments in early childhood education and programs for retention, for instance, stopping school dropout, especially for low-income youth, those youth who are from communities that are historically disadvantaged, whether on racial or religious lines. We've seen a lot of dropout actually during the COVID era of underserved communities because of the difficulty with Zoom learning. All of those things happening before age 17 have long-term effects. So just to give a couple little pictures here, just to put some data on this, these are just two of like gads of slides I could have shown you. These are two just different examples to show just the centrality of a high school degree. Again, not even, a PhD from Harvard, but a high school degree, just how important it is. So here, this is work by Jennifer Carras-Montes, who does superb work on regional and class variations in health and well-being. So here it shows kind of your odds of death, right, based on education. So here, the more educated you are, going from left to right, the lower your risk of death. But there really is this big drop off upon getting a high school degree. So this again suggests it doesn't necessarily mean public supports for folks to get PhDs, but rather just making it to that high school degree. And there might be other cut points of relevance in other sites, but in the United States, high school degree really is quite important. Here you see a similar trend. There's a lot going on with these bars here, but the main takeaway is this is the proportion of adults age 65 and older who have what we call probable dementia diagnosis. So that's either a certain number of symptoms on these cognitive tests, or your own or your loved one's report that you have been diagnosed with dementia. And so the one thing you can see here is these different color groups are different ages. For people of any educational level, your risk of increases with age, right? It keeps getting bigger from here to here to here. But what we see is the differences between high school grad, some college grad. You see a little bit of difference across these educational groups, but it's nowhere near as dramatic as this, right? Those who have less than 12 years of schooling, about 9% versus, 1 to 4. So high school dropouts of any age have a much elevated risk of probable dementia relative to those with lower levels of education. And again, your education ends when you're in your teens or 20s, and this is a probable dementia diagnosis, 50, 60, 70 years later, just underscoring the importance of early life factors for later life outcomes. I think I'll skip that in the interest of time. So that just gives you kind of a sense of how inequalities unfold, why things that seem like a small or modest difference early in life can really exacerbate over time. I didn't talk much about the mechanisms of why it is that education would lead to these disparities in all health outcomes, from mortality to dementia. But it's the range of things that you're probably thinking about: the quality of a job one has, whether it's intellectually challenging work versus physically grueling work, whether one has cognitive flexibility, which is something that's an outcome of education, the ability to creatively problem solve, things like health literacy, health behaviors, being able to afford healthy coping tactics when you're faced with a stressor, like exercising or yoga, as opposed to smoking or drinking beer to excessive amounts. So health behaviors, access to health care, and cognitive flexibility are just several of the many mechanisms that link early life economic factors with these later life physical and cognitive health outcomes. So in the last couple minutes, I will just walk through future projections, right? And future projections can always be wrong. Every demographer knows this, right? There are all these post-baby boom predictions that were like shockingly wrong. So maybe take some of this with a grain of salt. So they're weak projections, but I'm just going to highlight a couple contemporary issues that may bear on the future lives of late baby boomers, Generation X that follows, and then millennials that follow. And millennials, as many of you know, are now a larger cohort than boomers, not only because there were lots of them born, but because they have higher rates of survival, like the boomers are starting to die off given their more advanced age. And what will happen to the millennials is going to have a really major impact on policy and society. So here are just a couple things happening that I think bode not terribly well for the younger cohorts, but particularly for those who face either economic inequality or racial oppression of these younger cohorts. And one is rising levels of income inequality, right? This is something everybody's heard a lot about. We all carried around Piketty's book on inequality, even if we didn't actually read it, because it was a very, very fat book. But here's a chart that economists have generated. The magnitude of the difference has been debated, but no one debates the fact that the bifurcation between the wealth held by those at the top of the income distribution and at the bottom has just been widening dramatically over the past 30 to 40 years. The main explanation given is Reagan-era tax policies that favor the rich. That's one of the many engines that are driving this. But what this means is what we'll have for, the professors and doctors and lawyers who will be part of the elite who have access to premium healthcare, good homes, and those at the bottom of the income distribution will do far less well. Here we even already start to see generational differences in wealth accumulation. And again, there's a lot going on here other than to say that even when you control for their age, your average millennial who's 30, for instance, has a much lower rate of home ownership, much lower rate of wealth accumulation relative to a boomer when that boomer was age 30. So lots going on here, but the main takeaway point is that going backwards from the silent generation, those who are old now, the boomers, Gen X, and millennials, it keeps looking worse and worse with respect to wealth accumulation and rates of home ownership. And we know home ownership is really important because for most people, it's that main asset you have to sell when you need long-term care. And although public perception is that millennials have no money because they're buying fancy coffee and avocado toast, that's actually not true. Their rates of savings are pretty good, but they all happen to be in higher rates. They're straddled with educational debt in ways that prior cohorts did not see. So that's one trend that doesn't bode well. Other things, lingering impacts of the Great Recession and COVID, it disproportionately affects young people. That in the recession, if you were 60 and owned a home, the recession didn't matter that much. If you were 25 and just starting off in the world and trying to find a job and trying to save enough to buy a home, the hit was much larger. And we know that financial hits that happen early in life, right, due to cumulative disadvantage theory, just widen over time. We anticipate the very same thing to happen due to the COVID financial crisis impacts, right? It'll disproportionately derail the lives of those who were younger and starting out, as opposed to those who are older and more established. Also, we know that early life health problems that shave years off your lifespan and also increase your risk of workplace disability and exiting the labor force early are things that are happening in larger numbers among the newer cohorts, but especially for those who are from lower income communities, everything from opioid use, obesity, COVID-19, all of these things which have long-term consequences are disproportionately spread throughout the population. Another that's a difficulty is that we don't know what's going to happen with caregivers. There's a big conversation today that we just don't have enough caregivers for older adults. Here's our caregiving ratio because family sizes are smaller, right? People are not having 4 kids anymore. They're having 1, maybe they're having 2. So this is a big debate. A counter debate is that with reconfigured families today, you might acquire a stepchild who could be your caregiver. Most of the data so far show that the stepkids aren't doing such a great job of caring for the older mom or dad. So marriage or remarriage as a pathway to acquiring a family caregiver so far doesn't look like it's going to take. But this is a continual debate. Who will care for our elderly if they do not have children who are proximate and who have the physical and economic wherewithal to step up and be a caregiver? So then another is just in general, the dearth of paid caregivers as well. That's something I mentioned earlier. I'll just end with this slide here. We need caregivers, right? We knew that there was a shortage of CNAs during COVID, and it's only going to get worse. And so this is a slide that I show very often. I just keep updating it every year. If you look at the Occupational Outlook Handbook that Bureau of Labor Statistics puts out every year in the US, and I suspect you'd see similar trends in other nations, they project what jobs are growing most rapidly. Where do we need people to work? And year after year after year, home health aides and personal care aides, these people here, always come out in the top 5, as well as other types of caregivers. But what makes these jobs different from the others? Well, they earn a median income of $26,000 a year, which we know is not a living wage. So how are you going to incentivize people to be healthcare workers when they're just not earning enough? And on top of that, this is a job often entered into by women of color, which just perpetuates inequalities. Again, it's kind of a sad tale that those who are caring for our most vulnerable are the ones who won't be able to afford care for themselves when they reach that age. So those are some projections that are not particularly optimistic, especially for those who are now growing up and who are in communities that do not have high levels of economic resources. But there's always the prospect for change. We have a new administration, and I think there is some optimism that well-designed policies in any part of the world and public-private ventures, among other things, might help. Things like Medicare for 50 or greater access to care and social support for care in other parts of the world. So I'm going to leave it here because I went over a little bit, but in our conversation, we can brainstorm about ways to remedy these challenges that we're seeing at the global level. So thank you for listening, and we will now have a conversation.
Thank you so much, Professor Carr, for your presentation. It's really eye-opening, and it resonates a lot with a lot of the publications that we have within the department on aging and inequality. Just the fact that despite these global gains, when you look at the trends over time for different groups, you see these huge disparities. Everybody's doing better, but not at the same rate. Also the point in terms of, how the symptoms of inequality can shape older adults' health and well-being, but starting from a very young age and throughout the life course. And, it's not only about a conversation around aging and inequality is not only about today's older people, but also looking at what aging will look like for future cohorts, and that how the historical context now is so different than those lived by today's older adults. At this point, I'd like to open the floor for questions. It seems like we already have a couple. Feel free, please, to put them in the chat, the Q&A. And I think we could probably take a couple at once and give you a chance to respond. So one question we have here is a broadly accepted policy recommendation given increases in average life expectancy is the need to increase age at retirement. What are the pros and cons of increasing the age of retirement from an inequality perspective? Is this a socially fair measure? Otherwise, are there ways to implement this measure in a more fair manner?
Yeah, that's a great question. And you do hear that, right? The age at which someone can get their Social Security benefits, at least in the US, is increasing over time. So for those born in the 60s forward, it's age 67, right, as opposed to age 65. And so increasing that age of retirement is viewed as a way to basically develop a more fiscally sound public pension policy. I mean, I personally am not opposed to this global increase at retirement age for specifically the reasons that we talked about. I think kind of the great irony of retirement is those people who can afford to work until age 70. There's some who can afford to work in perpetuity, but they hold jobs that don't particularly require a strong young body, right? So if you're a professor, if you're a lawyer, you're a doctor, at some level, we can sit at our desks and work until we're 70, even though we don't need to. But think about someone who is a waiter, a construction worker, a bus driver, who starts to have the earlier onset of health problems at a much younger age. They have jobs that require youthful bodies. At the same time, their relatively lower earnings require that they sometimes can't retire at age 65 because they need to keep pushing out the age at which they work to increase their income. And again, if you push out retirement to an older age, it's good for your benefits. And so I think a universal increase in retirement age is disproportionately going to hurt those whose bodies are failing and are mismatched with the physical labor jobs that they hold. Coming up with a solution is the harder part, right? I mean, in our nation, we tend to have universalistic policies, and how might we, allow people to work earlier? And I suspect it's just relying more heavily and supporting more adequately these other policies. And it's something as simple as better healthcare for younger people. And even if in the US we're not ready for Medicare for all, even Medicare at 55, Medicare at 50, just providing some health supports for those who need it. Obviously, investments in disability, right? That's something else that's really important to do. But it's, I think, a major challenge. And again, I'm talking only from the United States and other places. I'd be very curious to learn more about what countries that have more effective social safety nets are doing in this regard.
Thank you very much. As we wait for other questions from the audience, I will abuse my role as moderator to ask some questions that came across during your presentation and in reading your books. I mean, one of the questions I had, and you mentioned it a little bit in the beginning, in the middle, talking about cumulative disadvantage, and the example that you gave there, the illustration, and one of the questions that we're interested in is thinking about the different mechanisms through which social inequality continues to impact health and well-being throughout adulthood and later life. So one question around there is, you mentioned education, but can we narrow down the mechanisms and kind of think about a handful of primary channels through which social disadvantage at earlier ages affects health and well-being at older adults?
Yeah.
And then related to that question, then, if I can ask another one, is then, within this framework of cumulative disadvantage, how do you fit in the role of resilience? Because clearly this is not destiny. Some people do come from disadvantaged backgrounds and don't see the same kind of negative outcomes that their counterparts might see. So then, can we identify some kind of protective resources in adulthood or in adolescence or even earlier that would help to overcome the long-term effect of early events?
Yeah, that's great. Those are really good questions. So the first one is about kind of the sites of intervention, like education, but that's a broad thing, right? If we had to invest our money somewhere, what would be the thing, the mechanism? And then the second is about resilience. I guess I'll start with the second one first, that's always easier. Resilience is really an important issue, and because there are people that are considered the off diagonal, right? Those people who have low levels of education, they grew up in adversity, and still they manage to thrive and prosper. And there's a lot written about things like planful competence, right? These psychological attributes that help people to survive. So it's things like personality traits like optimism, or creative problem solving skills. And so in the psychological literature, there's a lot of emphasis on these kind of what we call non-cognitive skills, kind of personality based. And some disciplines were a little reluctant to kind of recommend, tremendous investments in just kind of think yourself happy, think yourself creative, because it neglects these structural factors, right? And for those people who are facing things like structural racism, being a creative problem solver might not help all that much. So I think one is that, social supports, like I always argue for having family who can, support and provide emotional help or practical help, for instance, is really important. Family and medical leave is a policy lever that's relatively straightforward. And so if people had access to a caregiver to help them through these difficult stages, right? And the caregiver, so someone taking time off work to be a caregiver, whether it's to a child or an older adult, who can help them kind of overcome these challenges without losing their wages, is something that is really important. So I would say investments in those support systems. There are other things at the young level, and this sounds very small, but there's actually a surprising amount of data in support of mentorship, right? That sounds very small, but for young people, having someone who believes in them, and more practically, someone who can help make connections for them, whether it's a workplace opportunity, a first job, recommendations about how to navigate a school system. That's something at the smaller level, those kind of matching programs, provided that they're entered into willingly by both parties and they're sustained over a long period of time, that kind of continuity of support. That's kind of a smaller intervention, but it can be protective, right, for increasing resilience. So those are just a couple, but you're absolutely right. And I think we want to emphasize, again, that early life is not destiny. And then just a couple of other early life things that also, they're small, but they're not small. Nutrition. I mean, that sounds kind of silly, but nutrition and access to things that help keep a kid clean. That sounds really silly, but a shower and clean clothes and nutrition, even having washing machines at school. You hear about these, that a child has a high level of absenteeism, for instance, because they're embarrassed that they don't have lunch, they don't have clean clothes. And keeping a kid in school and having them feel accepted in school by giving them kind of food and clothing is something that actually can help them to rise above, right, some of those challenges that they might have because they are staying in school. So those are a couple kind of small level things that one could talk about. The other big question about, what are the sites of intervention, right? Like if we give everybody an extra year of schooling, are we going to be helped? There's new data suggesting that it's not just years of schooling, but quality of schooling. You can make it to year 12 in a not very good school system by being just pushed through social graduation. You can barely read or do math, right? And that's not going to help people when they have to kind of manage complex medication regimens. So again, investment in the quality of schooling and ensuring some minimal level of literacy upon graduation, I think, is something important. Anything that can help people to maintain healthy, active lifestyles. So ensuring that low-income neighborhoods have access to healthy food through things like subsidized farmers markets, limiting advertisements for fast food and number of liquor stores in lower income neighborhoods, investments in parks and sidewalks, all of these things that make the physical environment safer. Because exercise isn't just a fun thing, right? Fitness levels, as we know, are linked with diminished risk of every possible negative health outcome, from mortality to cognitive impairment to diabetes. So any kind of investments in the built environment are really important. And then just one other thing to add that raises more problems rather than addressing questions. I've been talking a lot about the importance of education, but in the US, and I suspect in every other nation, education has differential impacts, meaning each year of schooling brings more income and brings more health for white people in the United States relative to Black people in the United States. And I suspect in other parts of the world, each year of education will bring more health, more opportunities for people of the privileged racial or ethnic or religious group relative to the devalued or stigmatized or oppressed group. And so that's a key question. Why is education not bringing those same rewards? And the very short answer is, again, systemic racism. So trying to figure out why it is that these gains are not happening. And that does relate to things like discrimination in employment, discrimination in lending practices, to be able to buy a home in a safe neighborhood and to procure a loan to pay for college without an absurd interest rate, which will just perpetuate. So I think that's a really important, much more global question that I don't think there are easy fixes for. But we are at this interesting historical moment where perhaps some people believe that there will be changes at multiple structural levels that will help, again, each year of education bring more rewards for those communities that have not been seeing the rewards reaped so far.
Thank you so much. I'm going to ask a series of questions, and I think they largely fall under intergenerational relations. So thinking about the distribution of resources and policies and how they might affect different age groups throughout the population. So one question is, are there examples of countries that have managed to avoid the framing of intergenerational conflict in the distribution of public resources? So in other words, are there good models to follow in building intergenerational support for policies to combat unequal aging? There's
Yeah.
another question then, as a follow-up to the previous question on retirement. So there's also the issue of increasing retirement ages and the effect that will have on youth employment, because you don't have this kind of turnover within the job market and opening up new positions for younger workers.
Yeah.
And then finally, we have another question to address in terms of diet, food, and nutrition across the life cycle and the related consequences for health in later life. I guess this is more of a comment here. Research has shown that we have managed to control those diseases that we can treat with a pill, some kind of prescription medicine, but not those that are related to lifestyle in terms of, healthy behaviors, diets, exercises, smoking and drinking behavior as well.
Great. Yeah, that's more of a comment, but yeah, that's absolutely right, because the lifestyle switches require more than just telling someone to start exercising. It requires, again, restructuring that environment to make it healthy. So I'll start with the first question. I have them all written down. I think I have them in order. The question about, are there societies that are kind of avoiding intergenerational conflict? And this, I actually have a quick slide I'll show you that I think is kind of interesting, that in general, I believe kind of the perceptions of intergenerational battles, for lack of a better phrase, are more muted in Asian countries. I mean, one is cultural. Again, we often don't like relying on cultural arguments, but the holdover of filial piety is a real thing. And so here are just some interesting attitudinal questions about different countries. I have this for like 30 countries, but this belief of who should provide care for older adults. In those places where there's kind of a greater belief that the government should do it, meaning, again, you have all kinds of taxpayers essentially gunning for those same resources, those tend to be the places where the perceived conflict is worse. So here, these are countries where, I'll put these here, this is like the US, Israel. It's really very high for government, right? See, these blue bars are really big for, I think the government should provide. And so Australia, you actually see kind of battles like the United States, because both in practice and in attitudes, it's something that the government should do. But in Asian nations, for the most part, Thailand is a little bit different, but in China, for instance, in Taiwan, they disproportionately, relative to other places, believe it's kind of the family's job. So in those places where there's greater reliance in practice and in kind of theory, attitudinally, whereby the family should pick it up, you tend to see less of these battles. But I do think actually in all countries, the kind of cure, for lack of a better term, of these intergenerational battles is to change the conversation, right? Every dollar spent on Social Security isn't taking away from a child. Likewise, just as AFDC isn't hurting old people. Why is that? Because families are interdependent. And this is the case in every country we've looked at. I mean, in Europe, people move away shorter distances from their family. Like other places other than the US, your family's closer by. And so if you are investing in child health, that means that grandma doesn't need to give her money to protect the child. Likewise, if your family in medical leave to support the caregiver, that means they don't have to make as many financial sacrifices to care for the older generation. So if we just keep reiterating this fact that the three generations of, grandparent, parent, and child are inextricably linked, and the investment that benefits any one generation will necessarily benefit the generation above and below, given these intergenerational transfers of care and of money up and down the generational ladder. I think that's something that could help. And I don't know how to kind of move forward these agendas and arguments other than, public service campaigns, rather than here's your brain on drugs, right? Here's what one investment in one generation can do for the full family unit. So it tends to be, again, better in Asia, partly culture, partly structure. And what was the other one? About young people. Yeah, this is a big question. If we keep older adults in the workforce, what does that mean for younger people? I mean, academia, you've heard this argument more than ever. Young folks can't get jobs because the boomers are holding on to their tenured professor jobs for a very long time. There's some data that show that this actually isn't happening because, and I can give the site later once I find it, but keeping older workers in the workplace actually helped, and younger people helped to kind of grow the economy. And so it's not like a direct swap altogether. There are some arguments that there's actually real efficiency to having multiple generations in the workforce, where older adults or older workers have kind of the big picture help that they can give to the younger generations, whereas the younger workers are better at kind of more tech-based skills. But you're right, in some professions that are very tight markets, there are the older adults are kind of clogging up the jobs. I mean, academia is one. Sadly, the place where we need the workers, as you could see from that chart, are often ones that don't pay well. So we actually need younger workers in a lot of the frontline service positions that are not necessarily inhabited by older adults because they're either retiring out or dying out. So what can be done? Again, I think paying living wages for all jobs. So if young people are doing entry-level jobs, they can support themselves. But that is a real challenge I think we still need to deal with. And most people believe we are going to have a labor shortage. We currently have a labor shortage. So maybe that will be some correction. But, and then the other is just fixing benefits so that part-time work actually will receive some benefits, right? So if you're a part-time senior worker and you can get some Social Security, that might be a way also to incentivize diminishing hours and opening that door for younger people. That was a really roundabout and not very good answer, but hopefully we can glean, some pre-associating together about what to do.
No, that's great. And I mean, unfortunately, we're at the end of our time together, although I think we could continue this conversation for a while because there's a lot of unanswered questions still. But I mean, in the interest of time, I think we'll wrap it up here. And thank you once again, Professor Carr, for your time today and for showing all the great work you're doing. And I hope that we can continue this conversation in other forums.
Great, absolutely. Thank you. Thank you everyone for attending.
And thank you to all participants for attending. Bye-bye.